patient has already been prepped for the lateral position for either a VATS or an open thoracotomy. Now we're going to drape the patient. So let's talk about the prep parameters before I drape out this patient. So assuming we're going to either be making a big posterolateral incision on the patient, or we're going to be making 2, 3, or 4 stab incisions for a VATS at various locations on the patient. So we're basically going to be prepping this patient from the level. We're going to start over the area of the thorax, okay, where the right or left lung is. In this case, we're operating on the right lung because the patient is positioned that way. So we're going to start in the area right here on the thorax, where the back onto the thorax, where we're going to be making that incision. We're going to go bedside to bedside. What that means is we're going to go up to the level of where the beanbag has been inflated, okay? So the patient's gonna be more like in a taco, a human taco with this. So this would be up more. We're going to go down to the iliac crest. We're going to go up to and include the shoulder, and then we're gonna swipe the axilla last. So those are our prep parameters. Now let's drape out this patient. Using either 4 blue towels, you might even need 6, or utilities, okay? We're going to start right there, cover the iliac crest. Then we're going to go down here. Again, remember this, the beanbag would be elevated here. And so the patient would be more sandwiched, if you will. With this, we can get on this side, we'll go this way. It's not going to stay, of course. Of course, that would be up to where the patient is sandwiched in there. And then finally, the very last square off, whether it's a utility or a blue towel, we want to be able to show a portion of the shoulder, okay? And we want to do that so that the surgeon has landmarks. So when we cover this up, we're going to show just a portion of the shoulder there. That way the surgeon can see these would meet up. These drapes would meet up on a real person, okay? So that we can see that. That way the surgeon can palpate where he wants to go. Now, one thing that is unique about thoracic surgery, most thoracic surgeons like to use an ioban, okay? Now, we cannot put an ioban on these mannequins, but know that this takes 2 people to place. The ioban could be placed either at this point after the square-offs, or it could be placed after we do the fenestrated, the overall body fenestrated drape, lap T sheet, then we could place this. Remember, on the ioban, for draping purposes, where the lettering is, you pass that to the surgeon or the assistant surgeon, and you will grab this part, okay? The surgeon will grab the part with the writing and be on one side of the patient. You will be on the opposite side of the patient holding this, and you will pull. The other thing that usually goes with the ioban is a folded blue towel for the surgeon to smooth this out over the skin. This is acting as an extra barrier. So this is unique to most thoracic cases and definitely a lot of general surgery cases. So we can place that ioban, and then finally, the last drape we're going to place is the overall fenestrated body drape, okay, or laparotomy drape. Orient the head and the feet. This is going to go right over where the incision site is going to be. This is usually done with more than one person. Holding on to it. And now This, we can now take a pair of Lister bandage scissors, this would be even a bigger fenestration, and we can cut this drape to fit.